more women than men?
More women than men attempt. Men have more completions.
Okay, thank you.
So again, culture plays a big part. Some of them have the protective factors like family or religion that helps them not feel, to go through with this. The Asian, the rates increase with age. African, men more than women. So again, it goes by culture also. The SAD assessment tool, have you guys seen this? The ones that have been on site? Have you seen them using this? Okay. So, they're going to use the suicide assessment tools. You're going to recognize the verbal clues, behavior clues. Again, ask them. That's a hard thing to do, to ask them. On the med-surg floors, we don't run into that too much, but assess their plan, determine their support systems. And I think I got the picture on here. Yeah, there's our SAD scale. But like I said, we're going to touch base on some of this again tomorrow. So, creating a safe plan for your family or whatever. Recognize the warning sign. Use your coping strategies. We've talked about, how to cope different ways. Socialize. Have family members for support. Know your crisis hotlines. Make sure your environment's safe. So some common nursing diagnoses: risk for suicide, ineffective coping, spiritual distress, crisis intervention, specific goals. And again, long-term treatment of any occurring mental illness, so planning, implementation, lack of evidence, long-term treatments. So what is your role in this nursing thing here? We'll follow the protocol at the hospital. Again, when you're in psych, you've seen this. For suicide precautions. Keep accurate records of the patient behavior. Right? Have you seen them establish a no suicide contract with anybody when you was there? Okay. Encourage them to talk about their feelings. See if they could stay with family or friends when they leave. Remember what she said, within, how long was I wrote it down? Within the first 4 weeks, going to outpatient, how many committed suicide, Sometimes they do not have anybody to stay with. Remove those weapon or pills. Encourage patient to avoid decisions during the crisis, right? This is not the time to buy a house. This is not the time to get married. This, encourage them to work through that. Again, community supports, and check medications. How many do they send them home with a prescription of certain meds? Did they talk about that inside? Anybody know? Usually not more than what? Within a week, sometimes a 1 to 3 day supply is all they send them, right? You don't want them to overdose on them, but they want them to have them to work. So they want them to have enough before they get in that outpatient visit. So it kind of varies, I think, depending on what it is. Survivors of suicide, again, they feel like they're going crazy. Family may be angry towards that person who committed the suicide, the family that survived them. And the PTSD is common. So as nurses, you need to know your own feelings and beliefs about suicide in order to serve your patients. I've known a couple who has committed suicide, and you feel like, why did they do that? Look at that poor family. It's rough. A few years ago, one of my students in my class, somebody else was talking about somebody that had committed suicide in a car, and here it was her husband that had done it. We didn't know that. She had never talked about it to us, and so then she talked about when he went through why he did it. So it was like, so know your own feelings and beliefs. Okay, couple of questions. Oh, I guess not. That's on my other slide. Okay. Anything? Questions? If not, we'll see you in the morning.